ASL. We'll be interpreting on the screen throughout the webinar. We are also recording the video with closed captioning for later viewing. And Carly, is there anything else that folks need to know? Thank you so much, Carly, and it is a joy to have you here today with us. And so Christina Guzman is also with us today to do Spanish interpretations. Christina, could you please share how to access the Spanish interpretation?
Sí, buenas tardes. Me llamo Cristina Guzmán y voy a ser su intérprete hoy. La conversación va a estar en Facebook de Urban Neighborhood Initiatives o está el archivo adjunto en el chat para que se junten con nosotros. Gracias.
Thank you so much, Christina. It's great to have you with us again today. For our experts today, please remember to speak slowly for our translator. Christina really wants to make sure, and Carly, that they are translating the important information that you are sharing correctly. Also, turn off your camera when you're not speaking to ensure that our ASL interpreter can be seen, and mute yourself when you're not speaking. We have a timekeeper today, which I think is Michael doing timekeeping today? I think he might be. And so for our experts, if you'll just keep your eye out on the chat, he will chat you your remaining time. And if you go over your time, myself or Jametta or Rajeshri will come onto the screen and gently remind you to wrap it up. So without further ado, I am going to pass the virtual mic to Miss Jametta Lilly. Jametta?
Accepting the virtual mic. Thank you.
You're welcome.
And I'm still tickled because I just can't wait to see Emerson, come back on the screen. And for all of you that know the work that we've been doing now for almost 18 months, this is a space and place that's all about family. So we welcome and laugh and love on our babies that join us as co-moderators and sometimes as our office assistants, as another colleague phrases it. My name is Jametta Lilly, and I am so blessed to serve as the CEO of the Detroit Parent Network. I'm a proud member of this coalition, a mom, and a proud nana of my grands that all are in Texas, unfortunately. But while we talk about our roles, one of the things in roles that I'm so proud of, the work that so many of us have been doing, really understanding and focus on our families from pre-birth through to age 8. And how can we, that have all been working, whether it's in health, education, social services, transportation, how can all of us make sure that we are creating a better system for early childhood and development, not only for children, but for families, and to do that at a system level. Having said that, I am so proud to welcome back to the program one of those entities that is fundamental to the change that is going on, certainly in the city of Detroit, and that is Hope Starts Here. The Hope Starts Here initiative team is joining us for a bit of a deep dive into sharing what their experiences are and what the plans have been for families as we look at opportunities, as well as some of the challenges that we've had in COVID. And to start us off, I'm going to ask for this team to come on screen. We're being joined today by Denise Smith. Denise is the implementation director for Hope Starts Here. Joining Denise also will be Jeremiah White. Jeremiah is the success manager with the Hope Starts Here team. Also, Chandra Marshall. Sandra heads up that important work of policy and research. Denise, I just love it, right? We've got policy, we've got research, we have data, and then to top it all off, how does it make sense for parents, and how does it make sense for parent organizations? And that's the joy of welcoming back again Bernita Bradley. Bernita is the Director of Outreach for Detroit Champions of Hope, and all of you are warriors for a better day and a better way for all of our children. Welcome to the Town Hall. Denise, why don't we begin with you? You're on mute, and I'm just going to lean back, and we're really interested in hearing your perspective and things that you'd like to share about Hope Starts Here. And I'll be following a little bit of your lead because I know you all have so much important information to share. Go ahead.
Thank you, Jametta. Appreciate you giving me a moment to unmute. We do have a few slides that we're going to use just to anchor us and speak to them, but we definitely want this to be an engaging conversation between us. So do feel free to ask questions that you may have, Jametta, as facilitator. We'll also leave some time at the end for additional questions. So as Jametta has indicated, I'm the implementation director for Hope Starts Here, and I'm joined by some colleagues and an imperative lead. We'll help you understand what that means in just a moment. But Hope Starts Here and its core is a connector of early childhood efforts in Detroit to mobilize this citywide commitment to support our youngest children. And by that, we mean children birth to age 8, or actually in utero to age 8, and their families. We understand that it is important to think about these children in the context of family and to begin to understand what it is that they are doing in that context. So Hope Starts Here began in 2016 as an engagement process where we engaged 18,000 Detroit citizens, residents, to help inform what would be important in terms of building an ecosystem that supported those children and families. What would be important? What are their hopes and dreams? What are the things that are missing, gaps in this system, lack of coordination? And so that engagement process actually informed the framework that we are now using to implement. I would like to say that our work, as we think about it, is really comparable, and I'm using this comparison often lately, to the dynamic development of a child. All of those systems that are developing in that human are definitely being informed by, even defined in some ways, by the family and the environment in which they are developing. And what we also want to elevate is that if we were to think about that child as a system we're developing, it's important to know that there's not a silver bullet, that there's not one thing that we can focus on, similar to that child's development. So the brain does develop initially. It develops at a pace that is extraordinary. And by age 3 even, we've got 80% of that brain architecture or structure that's already been defined. And yes, is influenced by the environment. So stressors, the things that that child doesn't get from nutrition, all of those things can impact that developing brain. But let's think about that brain in the context of the rest of that human that's developing. If that brain continues to outpace the rest of that body's development, we know that there'll be deficiencies in that child. Similar to this system development that we're working on, which is why we are using a distributed leadership model. We understand that all of the system pieces are connected and highly, highly interdependent. Our distributed leadership model has a governance structure that includes a cross-sector leadership team. Kresge and Kellogg Foundations were the initial foundations who paid attention to the fact that we had a service gap. So 1 out of every 3 children could not receive or even access childcare in the city of Detroit back in 2016. We moved that needle a little bit, which we'll share in a few moments. But it is important to think about all the work that we're doing here already, which is why we approach this work in looking at our current assets in the city before bringing in others, and making sure that we used our community assets to lead specific content areas or sectors of this work. In this distributed leadership model, you'll see our stewardship board is that cross-sector leadership. And then we have executive committee and some our team, our Hope Starts Here team. We have a physical sponsorship, but that cloud is that ecosystem of partners with the Hope Starts Here imperative leads and all of the other community partners, some of which are on this call today, who become a part of actually advancing what we have as our 6 imperatives, what we believe is important and must do's, and our 15 strategies. Underneath that, or coordinated with that, are 26 policy priorities. And so right now what we're doing is enacting all of that work. Our imperative leads have been deployed to actually work with community partners around specific sectors of the work, from health to parents and caregivers as leaders, first teachers and advocates for their children, to inspiring environments, whether that's brick and mortar or outside, safe and inspiring environments, making sure that our professionals, our early childhood professionals, have the things that they need to be able to do their very best, and that there's connectivity to the K-12 and an integrated data system so that we can begin to tell a complete and full story about what's happening for children and families in this community. And finally, and probably I would say an important element, which is to make sure that we're making the best use of our current resources, financial resources, and that we're advocating for and identifying where gaps exist and generating that revenue so that we can move the needle. I mentioned to you earlier that we had a seat gap. 1 out of every 3 children was not receiving, could not access, it just didn't exist, care. And so this slide here is providing you an example of what that gap is. I'm going to turn it over to Jeremiah White and Chandra Marshall so that they can talk to you about that coordination that Jametta elevated earlier, and how we're approaching the work with this intentional alignment of data, research, policy, and practice. Jeremiah?
Thank you, Denise. Thank you for sharing some of the level setting context around Hope Starts Here, our structure, and really how we begin leading with impact by starting with and driving with data. And so the indicator that you all see on the screen right now, data point around our seat gap and alignment, is one of a number of KPIs, or key performance indicators, that our initiative uses to articulate our impact. We want to know, what are we aiming for? And we want to know, how have we done towards improving what we're aiming towards? And so on this slide, you can see that we have a need for 44,000 seats, high quality, full-time, licensed full-day ECE seats for children of Detroit. And right now, we are on track to ensure that 19,000 of those seats are quality. What this means is that we have an opportunity to create or improve over 25,000 seats in the city of Detroit. So as we begin thinking about our contributions to closing the gap, we want to know, how can we begin to either create or improve these licensed seats that are needed to meet the demand of all children. And what we've understand that of the 25,000 seats that are needed, 16,000 of them will need to be created. They do not currently exist, whereas 9,000 of them can be improved. We currently have licensed seat that we can preserve or renovate the space to begin to improve the quality rating of that center. And so what you can see, just really essentially in leading with this data, is that we can begin to see where we're projecting, where we are, and begin to really break down some of the elements of the data to understand where the biggest gaps and needs are. This data is not exclusive as well. We want to be able to use this to inform action, but really begin to instigate our conversations around this gap. Other things that we can include would be our own contribution. So you'll also see that 243 seats have been added with the help of Hope Starts Here since 2021. We also see that 4,000 seats have been preserved or renovated as of 2021. And so we really find ways to now monitor these population level indicators while looking at them against our direct action team efforts. And so again, our structure and our initiative, all 6 imperatives, all have KPIs that they're looking at. We also are working to ensure that the intersection between our imperatives exists in ways where they can see how they share ownership and contributions towards these indicator sets. And for this indicator specifically, I'm sorry, if we can go back one more, I'll stay here for a moment. For this indicator specifically, we've really been intentional around making sure each imperative within our initiative can see the way in which they're driving or contributing to aspects of this seat gap. A few things to note here. We do not like sharing data without stories as well. And so as we're looking at all of this information here that just tells us a bit of how we're doing, we also work with our imperatives to unearth the story behind this data. What factors exist in community that have perpetuated why there's the gap, or maybe limiting our ability to improve the gap? Or what factors are currently existing in community that have helped us get to the 19,000 on track right now? What opportunities are there to continue to grow on the opportunities to support closing this gap? And a few things that I'll note here before I transition it to my colleague Chandra to help elevate some of the more research and policy-based aspects towards our practice is that we know a few things limiting our seat gap is that there are barriers to program quality. So licensing barriers and cost burdens are restricting even base level licensing programs to bridge into quality. We also know that at times there is a disjointed data system because data collected on everything from the impact to early childhood services to educational outcomes on disparities and the effectiveness of increased spending are sometimes disjointed and non-existent. It may make it a struggle for programs to have quality data to begin to target quality gaps that we're seeing in community. We also know that there are frontline hardships. For Detroiters, disparities are exacerbated due to COVID, and for marginalized communities, those who are hardest hit have been our frontline ECE workforce and professionals of color that are serving in these high needs neighborhoods. What we know is that in an equitable early childhood system, every child should have the opportunity to access high quality education, regardless of their zip code and regardless of their race. And so as we're working to make sure that we're capturing the story, capturing the data, both limiting and positive factors, we're also elevating the wave of historic funding that our communities are receiving. Governor Whitmore announced major budget proposals and investments to strengthen our early child care system, as well as the cross-system impact. Research now underscores the critical value of ECE in the wake of the pandemic and elevates the need for childcare to become available in order for families to return to work. And so there's this greater awareness of the cross-system impact. And all of these things we can begin to gather and generate simply by leading with data. And so now that we can level set with gap with what we know to be true and some of the experiences we're seeing in work, the next step in our initiatives process really is to begin to align our policy and practice to these aspects. And so with that, I'll hand it over to my colleague Chandra to speak towards some of our levers in action.
Well, thank you, Jeremiah, and also Denise for setting us up. And I will just kind of be brief about some of the things that relates to policy and action. So Hope Starts Here guardrails are our policy levers, and which are equitable access, quality, and affordability. This intersection elevates research, data, practice, and policy, which gets to action. One of the most promising activities done recently with our imperative leads was an exercise where we truly centered justice and heard from our imperative leads regarding their input, really in developing an equity-centered goal statement. This particular statement really spoke to the Detroit's early childhood system and really elevated the possibility of an early childhood education system, which would have sufficient funding and include parents and caretakers and families at all levels of decision making, and amplified how each citizen would have supports needed, including education, housing, jobs, and all resources desired. Additionally, this goal statement included the workforce and how those in the workforce should and would have access to everything needed to build their careers and retain those within and appeal to those interested. So this portion of the exercise challenged thinking and centered justice. Another part of this equity-centered activity was to take this goal statement and align it with policy pushes, because we know that if there's no policy change, often what should exist might not, and this essentially determined the ability to have long-term impact and sustainability. As shared previously within the Hope Starts Here framework, we have 26 policy priorities, and those priorities are distributed amongst the 6 imperatives. After the collective developed a goal statement, the next question was, which one of their policy priorities could get us our biggest win? So they reviewed their policies, and the imperative leads identified one or more policy aligned with that statement. And then the next step was to really think about the action. So the action is the advocacy component. And these steps provided the roadmap or a plan towards the true change that we need to see. So the process that I just explained is an exercise which could be used when trying to make the systems change citywide through advocacy, and all the while addressing equitable access, quality, and affordability. So I will pause there and hand it off to Bernita, who will share more of a perspective of parents and families and caretakers. Bernita?
Good afternoon, everybody. So my name is Bernita Bradley, and I'm under Imperative 2, Director of Outreach Lead. And I want to take you on a quick story of those same parents who were there in 2016, helping to plan what Hope Starts Here looked like for our city, are now community outreach coordinators and community outreach specialists under Imperative 2 and Detroit Champions for Hope. So in each district of the city, all 7 districts, we have one coordinator who helps to lead those parents and lead the team of community outreach specialists in those districts. The ideal is that they work in their district to engage parents and community members, community partners, and childcare providers around what this ecosystem will and won't look like for our children's future. Those parents right now have been leading the charge on supporting childcare providers with completing the Child Stabilization Grant, as well as brainstorming what their needs and their highest priorities are in their centers and in their programs. The idea is to push for an ecosystem that literally shares nothing but the ideas of the needs of those children and those families. If we are not pushing for what our children need, then we as a community are not collectively working to make sure our children advance. One of the highest priorities that we have as a team is to make sure that parents understand that they are their child's first educator, right? Knowing some of those nuances Denise talked about with brain development, practicing what we know now in the city called 6-a-days, where we engage our children daily with these 6 practices: hugging their children, dancing with their children, reading their children, encouraging, singing with your children, and pushing for policy at the state level to make sure that funding is even available in the community. Understanding that most of these things existed before the pandemic, we recognize that we have a large amount of families who are the working poor. Childcare has cost too much for families to even survive on beyond their basic needs. Making sure that child care providers were even provided for during the pandemic to have access to more children who some families were afraid to even put their children in childcare programs, but making sure they had things like PPE and were safe and caring. Again, our parents, when it comes down to childcare, their biggest priority is to make sure that their children are safe, loved, and that they're learning, and that they're ready for kindergarten and ready by third grade to read, right? And so, what does the ecosystem look like when we become partners? Like Jeremiah said, keeping parents at the table through all levels of this engagement, making sure we're hiring parents to actually make the change that they need to make. That we have funding for those parents to be paid. Parents said they no longer wanted to just be best actors, but they want to be employed to do this work because parents know what parents need and parents have access to parents. So I'll stop there, and then we can go into whatever questions Jametta had.
Bernita and Chandra, Jeremiah, and Denise, thank you so much for a succinct and global view of what Hope Starts Here is working so hard to achieve. And thank you also for making the point that Hope Starts Here, this initiative started in 2016. And like all good things, it takes work. And Bernita, thank you for lifting up in particular that not only have parents been at the table, but now are employed and being trained to be the advocates they always have been to push forward the change. Just a couple of kind of quick follow-up questions. You know, one of the things, could you just lift up a little bit more for us? Why? Why should the community, why should people in social services, housing, people who work in automobile plants, why is early childhood and the whole early childhood system development so important for everyone in our community to understand?
I'll start with saying, first of all, our communities will be no better off than the services and the partnerships we build on behalf of our children and the education that we give for our children. Our government systems are no better off than the education we provide for our most marginalized families. If we don't act collectively to make sure that there's a change systemically for all of our children in our communities, then we will have failed our future. If we don't educate and inform families that they have the power to make that change, even at a local level, even if it's just in their own homes with the 6 a days, even if it's going to the government to say what change they want to make in their communities. If we don't engage them to understand that power that they have, then the needle will never move.
Thank you, Bernita. And I'm going to jump in with her and maybe take a more scientific early childhood stance, given I've been in this work for 27 years now. And so for me, the importance is obvious. And I think there are more and more folks as a result of COVID, our business community as example, that are recognizing the importance of early childhood to our economy and to our society. But if I can go back to that child that I talked about earlier, we know that between birth and 5, that this is a consequential phase of human development. That brain that I talked about earlier is developed within that span and is providing the foundation for future learning and the application. So that testing that happens at 3rd grade, if children are not given the fundamentals and the foundation necessary to be critical thinkers, to be able to take an assessment and do well on it, we're continually have children at 3rd grade. Detroit is hardly hit with this grade level reading bill that can retain children. And a lot of that, as I've been advocating since the bill was in discussion, is because we haven't gotten downstream to support our children with these fundamentals that includes behavior and health. You'll hear from a lot of kindergarten through 2nd teachers that the children they're getting don't know how to sit or behave in a way, I'm doing air quotes, that allows for them to manage their classroom. A lot of the way that we teaching early really allows for children to be the lead and to explore. So there is a shift and there is a necessity for early childhood educators and those K-2 early elementary educators to understand and bridge that gap for children, because the children haven't changed, it's the systems that change. During these early years, though, we know that the brain is constantly gathering information about its surrounding world. Our children are discovering, trying to find out how to make sense of all these inputs. And it is preparing them for that anticipated world, that's what I just talked about. And so our environment during those early years, that includes physical safety, nutrition, responsive caregiving, profoundly influence how that brain wires and may even provide that strong or weak foundation that I talked about. And this ecosystem of early childhood education and care is just as complex and necessary to become much more fluid, because right now it is diverse and it is fragmented with multiple types of care settings. From Great Start Readiness for 4-year-olds to our private and public programs like Head Start and Early Head Start. Private meaning I'm in a home, I'm taking care of 6 children or 12 children, and they're not all given the same kind of supports or even financial supports or backing.
So the lack of equity, we know, is front and center. And that is one of the items that not only is Hope Start Tears leading in, but also the Kellogg Foundation and, of course, Detroit Parent Network is really proud to be focused right along with all of you about how we improve practice and how we improve policies to get us to a place where all of our children can bloom and thrive. But one of the things that we all know, particularly we were talking about the third grade reading, I've got a couple of questions that some of our audience, and in particular one of our co-moderators who's a mom of young children, wants to ask. One question before we transition to that, and that has to do with how in this unique time period, I mean, we're in such an extraordinary time period, Hope Starts Here team, in what ways have you been able to innovate relevant to COVID in either your policy, your practices, or program? And so if we could open that up for a minute or two, and then we want to transition to some of the questions from the rest of the team and the audience. Anyone?
I'm already ready to jump in, but I like Bernita to lead because she's actually on the ground, and as part of an imperative lead, you are actually doing the action. We're supporting that action. So Bernita, and then maybe Jeremiah or Chandra might want to add.
Yep, I'll say one way is advocating for change on different systems and even in different programming. So positioning parents and community members and providers to sit on committees, boards, and policy decision-making tables to actually make change and be a voice there, right, to represent the community, and training those parents and community members to sit on those spaces and stay there for the long haul, creating positions in organizations and businesses where those parents can eventually become employed, and then constantly partnering to push for policy, to push change, talking to local and state officials to actually push for policy change and become friends with even some of those people who may not be as friendly, right? Become friends with them to say, we need you on board to make this change for all of our children.
Great. Anyone else before we shift to Christine? How has COVID innovated for you potentially?
Yeah, Jeremiah, I'm wondering if you might share around a little bit about compiling that unique coordination now of all the different parent-facing organizations that might fall under and work with Imperative 2.
Yeah, absolutely. So COVID really helped us shine a light on our need to better understand, the contributions that we're making on the ground, so that we are able to begin to tailor, to curate, to begin to target those emerging aspects and needs that we're seeing in community. And so for us, with our structure of dashboards, Imperative 2 has had this really unique ability to now take the impact that we're aiming to create, that we're housing in their dashboard, and add on a software platform now that helps them track performance that's contributing to that impact. And so the performance that we're able to capture in and around the action teams of Imperative 2 include monthly and biweekly participation and partnership data. And within these surveys, we're able to ask, questions like, how have you helped be better advocates for yourselves and for families? Or the trainings and workshops and activities that you're engaging in, outreach and advocacy focused. We're able to really take an ownership of those activities and actions that are being deployed by our partners and volunteers, and allow them to be compiled into a space where we can see grouped performance while sharing, specific reports for the community outreach specialists, specific reports for the community outreach coordinators, for the organizational partners at the table, but allowing their collective efforts to be reflected in Imperative 2's contribution to impact. And so this is a really, really rich system.
Yeah.
Love
So
to
we
share
know, community, that we have a place to go to see who and what is happening to improve the services and quality to our youngest children and to pregnant families. So speaking of families, Christine, can you please come on? I think you've got some family members with you as getting ready to co-moderate. Your question, please.
I do. So there's a lot of families that watch and parents that watch this town hall. Early in your presentation, you talked about quality. So as a parent that's looking for an early childhood experience, and I'm going to use that sort of broadly. So the parent that, might choose to send their child to an in-home care facility or a daycare or a preschool, what are they looking for? What is quality? And so if you could just give like a couple of, what should a parent look for when they're looking for quality?
Thanks for that question, Christine.
No
I'll
problem.
take it. So I will this is a really great question. And why it's great is because there's so many varied definitions of what quality is. But as I try to create a space where families, and which we've been doing for a minute in Detroit, actually, I'm proud to say, to help families understand what quality looks like, tastes like, feels like. Right. And that is important when you're going in trying to find the best fit for your child, but also wanting them to be able to be ready for that next step. And so as I just broad strokes, what you need to look for in an environment beyond the health, safety, and cleanliness of environment are those interactions with the adults, the interactions between themselves, whether they're cooperative, and also how they're interacting with children. And so one thing you'll be able to quickly identify is whether or not those adults are on the same level as children, whether information is at the same level as children, whether they have as children and really these ambassadors of their own bodies have access to materials that they can reach and manipulate and do things with. So those adult interactions with children and between themselves are going to be critically important. It's often nationwide an issue when we're talking about class assessment, which is a classroom learning assessment tool that's used in Head Starts and others. These interactions are the one domain where, unfortunately, educators don't do as well in. Because it requires that you're letting the children lead and thinking about then how you scale or scaffold their interest so that you continue to expand their learning. So I would say, look at that environment beyond health and safety and say, what is happening from the child's perspective? Even get on your knees, sit on your bottom, and look at it from their view. And if it's not appealing to them, they're not going to get what they need out of that environment.
Thank you so much for that, Denise. Really appreciate it. I know that we've got to move on. I'm pretty sure we have to move on at this point, but appreciate all the good information. Emerson, can you say thank you?
Thank you.
You're welcome, Emerson.
Yeah, thank you. And Hope Starts Here team, thank you. And all of the probably hundreds of people that, for the point you made, Denise, some of us have been working on this issue for decades. Detroit is a leader in the way that we have not only worked to support and love on our families, but to organize ourselves and create systems of empowering, at the same time pushing for change. And this is one of my favorite things to do, which is when I like to talk about change, is to talk about people who are serious and committed and courageous in making that happen. And that's going to be, we're going to have the opportunity to hear from Congresswoman Rashida Tlaib. But what I want to do first is to introduce our other co-moderator that is really always a joy to have part of the program. And that is Rajeshri Bhatia, who is one of the directors at GVSU to make sure that our charter schools are working equitably in a coordinated fashion for great quality and care. So with that, Rajeshri, you can pay me for that introduction later. Is that good? Okay.
Checks in the mail, Jametta. Checks in the mail.
All right. All the time. We all are here to encourage and build each other up, because this is not easy work, but it is mission work. So with that, I'm handing it to you. Thank you. Well, as we talked about, we've got people who are committed to change, like Congresswoman Tlaib, who has stepped away to do something very important, and she will be back in just a moment. But while she's gone, let me take a few moments to just give a few updates on what's happening in schools. I've had the opportunity to connect with some school leaders, some parents, some teachers, and some counselors and social workers over the past week or so. And what I'm hearing is that there is a collective effort to ensure the health and wellness and the mental health and wellness of our students, families, and teachers in the schools. So you may hear your student come home and talk about conversations that they're having, books that they're reading. We've all realized that now, given what's happened over the past 2 years, and especially in the last week or so, really taking time to slow down for a minute and ensure that our children are happy and healthy is just as important as making sure that they know how to read and do their multiplication tables. Not one at the expense of the other, but really sort of a renewed, continued focus on that aspect of it. So, we encourage parents to talk to your kids at home. We encourage parents to be in touch with schools and with teachers and letting us know what you're hearing and seeing at home. It helps us do a better job for your children in the classrooms. And just if, I know everybody is spent right now, but I think that especially school leaders are doing the work of everyone and bearing a lot of the pressure on their shoulders. And I know we look to them for leadership, we look to them for strength, and they have been providing that in spades. But if you have a spare hug to give or a spare kind word to share, I'd encourage you to just drop a note to your school principal and other school leaders and let them know that you're there to support them as well, because they are really, they take this seriously. Any of us who lead schools and work in schools, this is more than just a job. It's personal. We take care of your kids. And that's something that we really, really take seriously. And it weighs heavily on us from the moment we, for all moments, even in our sleep. Many times we wake up in the middle of the night thinking about something new that we can do. So I just ask that if we can take a moment to be kind to our school leaders and our school counselors, please do that. It doesn't take much. Don't need to do a gift or anything. Just a kind word goes a long way. So as we wait for Congresswoman Tlaib, Jametta, why don't you share a little bit more about how your organization is supporting parents in schools? Because I know you're doing a lot right now as well. Oh, goodness. Yeah. So as one of the partners and part of the Hope Starts Here, we've been really delighted to do it on several different levels. Anywhere from very early doing tech light workshops to help parents as well as grandparents figure out this thing called Zoom. So providing opportunities for parents and grandparents to get some small group help, whether it's on their phone or their laptop, how to be able to access things like Zoom, Microsoft, etc. We're also back to the point that if our Hope Starts Here, we understand, I love the analogy, is that it's about child development. So we have to have a broad whole child perspective and then make sure the whole system is responding to that. So during COVID, we're so pleased that we have trained up parents with our parent-to-parent model as community navigators. And because we are not going to help our community get healthier or get through COVID, it's going to take parents talking to parents. So we've trained several of them, and several of them now have their community health worker certifications. They have been out at schools, community groups, literally hundreds of locations over the last 9 months, providing access to healthcare, food, also to early childhood and other basic needs resources. So we're here to make the point that we have to move forward as a city by including parents, but so importantly, equipping and educating them so that the power can come through. The other thing I would just like to share is, so we've done that on the health and wellness side. On advancing literacy, we've been really excited to partner, obviously, with Hope Starts Here and others, but we most recently are working with an organization called Beyond Basic, which is an evidence-based approach to make sure that children can catch up on learning anywhere from 1 to 3 semesters. And we have a pilot that we just went through our first pilot of recruiting, training parents in that evidence-based curriculum so that they are ready to be hired by Beyond Basics as tutors. So our Parents is Reading Tutors pilot, we're really so pleased to say that we've had our first 3 graduates of that pilot, and they are now full-time employees working with Beyond Basics, who in turn has them working as tutors in the school. So I think I'm happy to kind of share that. And our last thing that I'd like to share is that you've heard all of the Hope Starts Here team say this, is we've got to make sure that we're addressing policy. So our parents, Powered for Policy Change, are working and getting training, and we're offering that training that is at no cost to parents from anywhere. Our parent advocacy and parent leadership, so that we're working on policy topics with not only Skillman Foundation, Kresge, our Hope Starts Here partners, but also the Michigan Partnership for Equity and Opportunity. So we're working at grass tops and grassroots levels around policy, and we're excited about that opportunity for next year to have some parents powered for policy change to potentially present at the Mackinac Policy Conference. We're calling for parents need to be heard in all settings, including in this powerful business and influential sector, to bring intelligent and focused policy recommendations. So thank you for given me the opportunity to kind of share that too. We're real excited about it, and just had our annual meeting and getting ready to start celebrating next year, 20 years of educating, equipping, and empowering parents for change.
That is amazing what you are doing with parents and just empowering them. And it's just sort of the gift that keeps giving, right? The parents are empowered as a result. The kids benefit. You know, we all do. It looks like we have our special guest of honor. Welcome back.
I had to do my question line and I was multitasking, so I apologize. I was
no problem.
What? You do that?
We knew that you were doing important work, and so we definitely want you to do that. So, Congresswoman Tlaib, welcome. Thank you so much for joining us today. It's an honor to have you, and to have you not just today, but have you representing us in DC and doing us proud. So thank you so much for everything that you do. Without any further ado, let's get started and talk a little bit about the important work, some of the important work. We certainly can't talk about all of it, but some of the important work that you are doing on our behalf out there. So now the infrastructure bill has passed. Could you give us a sense of what is in the infrastructure bill and what happens next? How do we make sure it gets to people who need support?
Yeah.
How do we help?
Yeah, no, thank you so much for allowing me to share space with all of you today. You all give me so much energy. It's like being home when I'm in Washington, D.C. So I just really appreciate it. I do want to start off in really letting our residents, our advocates, everyone that's listening, all of you, there were 2 separate bills that were really messaged together. The bipartisan, they called the Bipartisan Infrastructure Bill, which I'll talk about. and the Build Back Better agenda or Build Back Better Act, all of which impact our communities. But in many ways, for myself and many progressive members, many people that have communities like mine with frontline communities, needed to see these both bills moving forward. And I'll talk about why. Because again, a lot of people are confused because that's how we talked about it. We talked about we need both. We need to push them forward. In these two bills, it's really important to know much of the harm set in the infrastructure bill, and there is harm, including taking away environmental study requirements for various projects, increasing, fossil fuel impact, and so forth. All of that to say is that, Build Back Better for me in many ways helped combat and that's why I supported moving that forward, combating some of the, what I would call the poison pills in there. Bipartisan infrastructure bill is really centered, and its whole heart of it is roads and bridges, right? You got to remember that. And then there are some, I think, supportive efforts in there that are impacting very much our school communities, and I'll talk about that. Build Back Better, I call it the people's infrastructure, and you'll see why, and why it had to go with the roads and bridges bill, which they call, again, the bipartisan infrastructure bill. For months, we had a deal in place to move both. What you should know is one got moved along and got signed into law, and that's why we're going to talk about it, the infrastructure bill. Build Back Better is still in the Senate. So I'm not going to leave this town hall without telling all of you. You're going to know why at the end of my discussion of why we need to call our senators and need to educate folks that Build Back Better needs to get out of the Senate. They need to pass this bill because, again, it is what is really critically important for many of our families, including healthcare, childcare, paid leave, so much of the real change that we need to improving our air quality, and the remaining dollars we need to remove all lead service lines in the state of Michigan. So again, that's in Build Back Better, AKA the people's infrastructure. In the infrastructure bill that did get signed into law and moving forward, there was billions of dollars investment into getting lead out of the water, but it was only 25% of what we need. National organizations, advocates know we need to be getting closer to 45 to 60 billion. This only had about 15 billion in the bill. The other really important was investments on broadband infrastructure deployment, right? Big, huge issue at this table, we're in this town hall. Wonderful. Know this, Michigan will be getting $100 million. Still a blessing, but I want you to know that means us making sure communities like ours is not left behind. And I emphasize that. Again, $100 million seems a lot, but we are a state of close to 10 million people, 9 to 10 million people. We need to make sure, again, communities like ours, frontline communities, are not left out. The other investment that you saw in there is the majority of it, a huge chunk of it is the roads and bridges. Some of the traffic, reducing traffic congestion. I know this is not sexy or fun for us on the call, but it also is, investment in our airport facilities. It's also one of the things I do like in there. It does invest money into public transit, really important over the next 5 years. The part of it in there that you hear a lot about electric vehicles, you've been hearing, President's been talking about it. In the infrastructure bill is only the charging stations. That's all. What is in the Build Back Better that is needed is the actual tax break to allow us to be able to afford it. And it also pushes and it says, hey, you get extra money if it's union built and American made, which is, again, really important in creating jobs here at home. So know that infrastructure bill alone will not get us to building these electric vehicles here at home, or actually making sure they're in people's driveways, in front of their homes and their garages. I think, again, that's really important. The one other area is a lot of upgrades on power infrastructure. Again, much of our outages and everything, you should know, DTE has the worst record in Michigan. We're, I think, the third regarding reliability when it comes to the electrical grid. Really important to note, this is a for-profit entity that controls our grid. They have millions, billions of dollars into investing in their shareholders, while we turn around and they said, oh, we need to trim trees. We all know, no, they need to completely upgrade. So know this, even though there's money in the infrastructure bill coming down to do some of that upgrade, know that we, the community, need to make sure the State Public Commission and others that are responsible in holding DT accountable, that they're actually investing in those upgrades in our community. Okay, so again, really important. Other investment was also on cleanup of contaminated lands and things like that. Now, my favorite part is Build Back Better. So it's important to know, and Build Back Better would allow childcare to 570,000 young children. Over 90% of the Michigan families with children under 5. Again, 90% of our families with children under the age of 5 will be benefiting from Build Back Better if the Senate wakes up and actually passes it, okay? In there also enables about 220, and these are specific numbers for Michigan, 220 more Michigan children from 3 to 4 years old to get pre-K services. So, what we call preschool or pre-K quality education, and a kind of good start for many of our folks. The other one in there that impacts groups like Urban Neighborhood Initiative and others on this call is a huge civilian climate corps program. If you all are familiar with AmeriCorps, and some of you are, it creates kind of a climate justice kind of AmeriCorps kind of model to put young people, generation of Michiganders, to work on conserving our public lands, building resiliency regarding flooding and green infrastructure, and fighting climate change. Also in there is $550 billion, the most we've ever seen, in fighting climate, so getting our clean air. You should know Wayne County hasn't met Clean Air Act standards since like 2013. That is dirty air that our children are breathing. And, I'm a big fighter in saying, children can't learn if they're hungry, but children can't learn if they're being poisoned. There has been asthma attacks, and they're drinking dirty water and getting poisoned with lead and so forth. So it's really important that you all know the importance of investing on reducing pollution here, and that's what they're going to use it for. Really doing what they call clean energy grid, and also, that's my favorite, really improving environmental hazards within public housing. $3 billion dollars is in there of my bill that would actually focus only on home repair, which is a huge, huge struggle for many of our families. A few more is obviously extending the child tax credit, which expires the end of this year. Also expanding Medicare to include hearing aids. A lot of folks, that's about 95,000 folks that will be impacted by that. It also has home care and so much more. There's a lot of things in there. The way we pay for it is we tax the rich. Really highly popular among all folks, but that's how this is paid for, by making sure people pay their fair share. And that's why I'm excited about that one too. But with that, I'll open up any questions. I have specifics on, how much money will be used for public housing, access to affordable housing. Again, there's another $9 billion in there for removing lead out of our service lines, so we can access clean water. A lot of our schools right now don't even have their drinking fountains in operation because of the contamination of lead. So with that, I answer any questions. I know you all want to know how we can get Build Back Better done, and I can talk a little bit more about that.
I say, go ahead. Tell us what we can do, how we get it done, and how we, get on this.
Yeah, I mean, look, we can't be complacent in that. Okay, the Democrats are in charge. The fact of the matter is, it's still causing some issues. We can't even get the Voting Rights Act y'all passed, and this is important because we've seen 400 different bills across our country we're going to make people look like us, people in communities like ours, make it harder for us to vote. So here we go. We said, hey, we want to be able to do the Build Back Better Act, which is really at the heart of President Biden's agenda. It is literally what he ran on: childcare, helping expand programs to uplift children out of poverty, to really combat climate in a way that's meaningful, and so much more. So this is the time for us to talk about, abolishing the filibuster, which is this unbelievable procedure and process that says, hey, 51 doesn't get a bill passed, which is so unbelievable to me. 51 senators out of 100 should be able to pass a bill, but they have a mechanism where they can push back. It's kind of obstructionist way of pushing back and saying, we can't get this forward, you move forward. And so that is one thing, is getting Senator Stabenow, Senator Peters on board, and really being vocal and much more aggressive about getting Build Back Better done in this year. You know, there's still talk that, oh, let's do it next year. I'm telling you all, if we don't get this done, I really think the momentum among senators and folks here on my side, you know, it keeps dwindling the more they make it impossible. And yes, you hear the name Senator Manchin, Senator Sinema, and yes, they are corporate Democrats. They rely heavily on the pharmaceutical industry. I mean, the fact that one of the most popular things that brings our country together, Republican, Democrats, Libertarian, Independents, whatever your political background is, the one thing that brings people together is like, wait, we're going to make insulin affordable. We're going to make prescription drugs more affordable. It is one of the most popular things. These are folks that are being paid by special interest folks to obstruct, and actually being told, according to a source, that they're saving our country. They're saving our country from who? From the American people who want these things. So it is important for you all to please don't stop pushing. They need to hear more from all of you. I can tell you, you know, I do hear more from folks telling me to vote for Build Back Better. And that's wonderful. But I wish it was more. You know, you don't have to, I mean, I already voted for it, but on the Senate side, I'm wondering if they're hearing enough from all of us. You know, is Peters hearing from all of us? Is Stabenow hearing from all of us? You know, talking about the groups and the families and parents on the call and everyone that's listening, you know how important that is. And you should know, you all, there is a pathway to what I call pathway to citizenship, pathway to allowing our immigrant neighbors to not fear deportation is in the Build Back Better plan now in the Senate. And so we got to make sure, again, that we're telling those stories, that we understand, again, the people's infrastructure, that Build Back Better Act, all the promises that really Biden made wasn't about roads and bridges. Do you all remember him saying, no, it was about helping the American people, working families. So we really need to be able to remind them of that, and not have them be deterred by the special interest groups that seem to taint the democratic process here and not allow what is incredibly popular among the American people pass out of Congress.
So the message for us is call often, keep calling. Let them know we support this. Absolutely. Yeah. Do it now.
And if you're on Twitter, don't be scared to not tweet at them. I know that's weird, but I find that some colleagues actually react to that. So.
That's great. Demetta, you have a question for?
Just a real quick question, sure, for clarification. And always thank you, Congresswoman. You know, you're our warrior and we love you for it. You made a statement that the Democrats are in charge. Could you just for a moment help families better understand what is a real majority versus what is not? Because we have a lot of folks who have a perception of power that indeed, and they were blaming folks for things not getting done. So one, can you clarify it for us really quickly? And what does that mean in terms of getting out the vote in 2022, if you would?
Yeah, so for you all to know, it's very rare. I can't remember, Larissa can find out the history here. It's been a very long time since we had a president that's from the Democratic Party. He's in charge in the White House. In the Senate, the Democrats are in power and leadership. They hold the gavel. In the House, same here, hold the gavel. And yes, it is smaller minorities. Maybe, you know, we're short 4 or 5 votes. In the Senate, there are 2, sometimes up to 8, depending on what the issue is among Democrats there, that might not be supportive of, you know, the people's infrastructure or some of the, you know, issues regarding the pharmaceutical industry. I can tell you, even in the House, these are people in what I call safe Democratic seats. Jametta, I'm going to tell the truth. I mean, these are safe Democratic seats. These are not folks that are, you know, in seats that are, you know, conservative or have some issues. I mean, you know, have big pharma in their communities. No, and they're still in committee voting against some of these very popular bills and initiatives. So what you're saying is right, and that of course we need more people like myself there. But I also think this is the time to push. I mean, with everything they've done, and I think the president, you know, working with both sides and trying to find commonality is great. But like I was listening to NPR this morning. For all you to know, President Biden's numbers and popularity is getting very low, even after he passed all of this. And I really think, and again, I'm not an expert, but I really think it's because people need to feel that meaningful change right now, and need to move quicker with urgency.
Yeah,
but I think it's important. I'm actually too Democrat for this chamber. Okay. And that's the truth. I will not waver on worker rights. I will not waver on any of these things. And I understand. But if we put profit aside, make it number two, put people first, we probably would be in a much better place. Folks would not at all blame us for saying, oh, we got to make medication affordable. Great. There's nothing that kind of, you're saying we can get clean water and clean air. Yeah.
I asked you this potent question, and I've got all of, my phone is blowing up. We're out of time.
Yeah.
But these are critical issues, and we would love to be able to have more conversation.
Yeah.
So you're reminding us, if we think childcare is important, if we believe that the rights of workers are important, families, communities, we've got to get busy and make sure that our voices are heard. And so work with your congressional people, work with your organizations, work with our leaders. And we want to let you know, all of you that are listening, we have one more program for this year coming up next Thursday. We're all going to take a little bit of a break, and we're going to continue to come back with great information, good resources, trusted, and make sure that you know what's going on. We have a couple other really wonderful things to share. Deja, keep us rolling on these slides. Of course, there are people that want to have children and that they have children and toys. Here are the various locations that you can go. We've put that information in the chat for you. In addition to that, there are some wonderful activities coming up. The Urban Neighborhood Initiative. Yes, that's Christine Bell's organization. They are ringing bells of joy at a holiday party that is coming up on Saturday, the 11th. Can't wait to see that. Christine, hopefully I can even make it. And then we want to remind all of you, remember, we are living in COVID. We've got to stay masked up. You still, please make sure you are social distancing. Get your tests. You can get tests, and make sure, please, that you are getting vaccinated. It's about our whole community working together to keep each other safe so we can thrive as both our families and as a nation and world. And with that, I'm going to ask all of the partners that help make this program happen to please come on screen, and let's, as we always do, this is a collective effort. And so we want to say goodbye, be safe, be well, stay powerful. Bye, Emerson.
Bye.
Hi. She finally said something.
All right, we're all clear. Good job, Emerson.
Yes. All right.